and I've been very happy to met him here at Stanford, and actually I was part of the search committee, so I was very excited when he accepted the offer. So Dr. Ruben Alvero is a professor in obstetric and gynecology at Stanford University. He's the division director of the Reproductive Endocrinology and Infertility at the Lucille Parker Children's Hospital. He comes from his college graduation at Harvard and received his MD at the Uniformed Service of the University of Health Science in Bethesda, Maryland. He completed his residency at the Walter Reed Army Medical Center and fellowship in reproductive endocrinology and fertility, REI, at the NIH. Dr. Alvero previously was a professor and a division director at the University of Colorado and Brown University, fellowship director at REI at Brown, and residency program director at obstetric and gynecology at the University of Colorado. He has been NIH funded before and after Endurance, so we've been very happy to follow his successful trajectory. Dr. Alvero is a past president of the Society for Reproductive Endocrinology and Fertility and is currently the American Society of Reproductive Medicine Board of Directors. He's currently the editorial director for the Journal of Fertility and Sterility, and he is, most important, a 27-year veteran of the United States Army. He retired as a colonel. His service assignments include many places, interesting, this is a totally different topic that we like to talk to you, Ruben. Your time in Germany, Mongolia, Kuwait, Iraq, DC, and Texas. He's a native Spanish speaker, and he's a devoted to care the underserved populations that we all know. And today we have the great honor to hear about climate justice and the human health, where we are, where we're going, and what you can do to help. And he did promise here that we'll have a hopeful conclusion. So thank you so much. Gracias por estar aquí.
De nada, Caterina. So I thank you very much for inviting me to give this talk. This is something that I've been working on actually relatively recently. I'm a newcomer to this field in general, but I think it's something that is important, and I've been very happy to kind of make this the next step in my career. As some of you might know, I'm retiring later this year, but I'm hoping to continue this work here and elsewhere going forward. And so, in terms of climate justice and human health, sometimes when you hear these talks, there's always kind of, doom and gloom, oh my God, it's relentless, nothing's happening, nobody's doing anything, and, the world is going to be difficult. But in fact, I think that there is probably a hopeful conclusion. It may surprise you what that is, but I think it hopefully in the end we will be successful at working with this. So let me see. Okay, so I have no disclosures that really conflict with this talk. I'm a scientific advisor at a couple of basically startups. All right, so where are we? Well, I think we see the news every day, and here in California, we're pretty much on the front lines of the climate crisis, although this is obviously something that's happening all over the world. Here in California, we face heat emergencies, we face wildfires. This wildfire season has not impacted us directly as much in the Bay Area, but it certainly has been very impactful throughout California. We've had, heat emergencies throughout the state and really through the country. This is something that shows up, and people, see it on the evening news or wherever you get your news. And then once it's gone away, everybody forgets about it. But it's important to know that this is something that is actually getting worse and worse and worse. There's also some kind of unexpected stuff that's happening. So this is one that just showed up this week. And it's something that last year in 2023, there was a landslide in Greenland that caused a quote unquote unprecedented seismic event that led to a tsunami that led to the Earth vibrating for 9 days. Now, I don't remember the Earth vibrating for 9 days back in the day, but I, can't imagine that's good for the Earth to vibrate for 9 days. There's actually not a lot of editorial comment on any of these stories as to what Earth vibration for 9 days does to the world, but these are things that just start happening and come out of things that are just not unexpected. It's beyond just the heat emergencies, and there's a lot of other stuff that's unexpected, and I think that we anticipate that there might be other kind of unexpected events such as this one. So in terms of talking about climate science, I'm not going to go into real depth on this, but basically, I will say that the climate science is established. It's well established, and there's both national, U.S., and also international data to support this. And there's really no controversy about this. Here in the United States, the assessments, the kind of the integrated effects of climate change are usually best summarized in the National Climate Assessment, which come out about every 5 years. This is something that was congressionally mandated in 1990. The most recent one was back in 2023, so just last year. As you can see from the graph here, this is something that is going up pretty relentlessly. I think that this summer we actually broke through the 1.5 degrees Celsius average temperature. So I think that, the net zero that we're hoping to achieve, and also thereby to keep the temperature increases to a sustainable level, we've kind of broken through. And I think this summer is when we did it. The takeaways from the NCAS was that U.S. greenhouse gases are indeed falling. So the emissions are falling every year. But regardless, despite this, we're still seeing increasing temperatures throughout not just the U.S. as we saw this summer, but throughout the world. And without sustained decreases in greenhouse gases worldwide, these temperatures will continue to increase. How they'll increase is something that we'll talk about briefly later in the talk, but this is something that is still uncertain. And then certainly worldwide and even in the U.S., the current trends for greenhouse gases decreasing is not sufficient to reach net zero. And what we're hoping is net zero, which is the amount of carbon that's created and the amount of carbon that's taken out of the environment is a net zero. We're not close to that at any time under current models. And extreme events are increasing, and this is something that affects humans. Now, so how does it affect humans? This is something that is actually not as clear as people would think. I mean, we think about how it might affect us, and I think it's something that we are having some issues communicating, both with the medical communities and also with the society writ large. Ed Maybach is somebody who's been working in this field for almost 2 or 3 decades at this point in time, has actually put together this kind of conglomerate assessment of how human changes, both in terms of climate change, but all the other impacts that humans have on the environment, how it can affect human health. Infectious diseases, that's something that's probably obvious as temperatures increase. The zoonotic ranges for some infectious mosquitoes and other infectious vectors increases. Non-communicable diseases, which is really another way of saying really chronic diseases, are also going to increase substantially. Nutrition is affected by how much food we're able to harvest. This is something that's going to be increasingly impacted. And, this is close to home because California probably produces, I think it's something like 80% of the national produce. And this is something that is going to change here in California. Mental health is something that is significantly impacted because of the environment that patients are facing, that individuals are facing with heat emergencies. I mean, I think, we can think back to a couple of years ago when we had those kind of Martian landscapes here in the Bay Area and what our mental health was and how we felt about it. You can imagine someone who's more vulnerable, less resilient, this would be something that would really be significantly impactful. And the mental health data on the impacts of climate change on mental health are probably among the most strong and easily understood. And then there's also significant changes in terms of displacement, conflict, trauma, water wars, and so forth. As the environment changes, water becomes scarce in some areas, there's displacement, and individuals move from one area to another, which inevitably leads to trauma. Despite all of this, which is pretty straightforward, this health has really not had a seat at the table in terms of the national and the international, I should say, health effects of climate change. In other words, climate change advocates throughout the world really have not really focused on human health as much as you would expect. And in fact, at COP28, which is the most recent world UN mandated meeting that took place in the Middle East this summer, it was the first time there was even a day. Usually they have focus days, and they've had focuses on other areas, but this was the first time they actually had a health day, which was the first time they really significantly recognized health as an issue. As a lot of us that are starting to work in this area say, it's not just about the polar bears, it's also about the humans. So how does this affect us? And I'm going to kind of really jump fast right and kind of hone in on our own area, which is obviously reproduction and OBGYN and maternal fetal health. The data are really pretty strong that climate change is already here. That is something that's already impacting our patients. It's a little bit silent because it's hard to know and separate cause and effect for some of these effects on our patients, on the patients that we deliver, the patients who become pregnant under our care. But it's something that is happening, has been happening for quite some time at this point. One of the most interesting papers that was written, this is a systematic review by a fellow named Becker, who I think is at Texas, if I'm not mistaken, who basically reviewed 68 studies and looked at the health effects of climate change based on heat emergencies and other climate events. Looked at 32,000 births plus, and looked specifically at PM 2.5, which is something that you see in the literature as a really important metric to assess in terms of the impact on patient health. And basically, it's the particulate matter, so really small particulate matter of less than 2.5 micrometers. So it's a measure of a kind of pollution, if you will. And then ozone, it actually had significant increases in preterm birth and low birth weight in multiple communities. It was throughout the U.S. All U.S. regions were affected, and it was particularly in the theme of our climate justice. It was exacerbated by individuals who had prior asthma, and also in African American populations, it was really particularly increased as a risk for preterm birth and low birth weight. We've had some actually natural experiments, which is really interesting. So here in California, we're in the process of retiring oil and coal-powered power plants. And over the course of 10 years, there were 8 plants that were closed throughout the state. And this Casey, who's an epidemiologist, looked at the preterm births in a radius of 5 kilometers and then 5 to 10 kilometers and then beyond for patients in the vicinity of where these power plants were actually retired. And overall, there was a decrease in the number of preterm births within a short period of time in those communities that had those power plants retired. There was a dose response effect, and that closer to the site of the retirement was more impactful in terms of the reduction of preterm births. Because it was an epidemiologic study, it was a very complex calculation. So it was the difference in differences is what they calculated as their outcome. Nevertheless, there was significant impact. And it looks like the impact was really not something that showed up until 32 weeks of gestation. But at 32 weeks of gestation, with the retirements, there was a significant decrease in preterm birth, which was greatest in the immediate vicinity of the power plants. There was also, again, in keeping with the theme of today, the most impact was on Asian and Black patients, where there was a very significant decrease in preterm births, although there was also a significant decrease in Hispanic and white individuals. There is a lot of data. A couple of months ago, so I think, no, actually it was in March, I did a lit search on, the intersection of climate change and maternal fetal health, and there were already 600 publications in 2024 on this. So this is something that is already, obviously being seen in the literature. One of the things that, since we're actually on Zoom, but not a webinar, one of the things, if somebody can shout out what they notice about all these publications. Does anybody notice anything that's a common theme in all these publications that I've shown you so far? Well, I'll cut to it because it's where we got short of time, but basically none of these have been in the OBGYN literature, if you look at it. And the OBGYN literature is not to say that it doesn't have any research, but the research is primarily in non-OBGYN literature. Additional papers that have been, of the many that have been produced, include an increase in placental abruption that occurs at higher than expected levels in women in heat emergencies, that wildfire exposure is associated with preterm delivery and also IUGR, and then miscarriage is associated with adverse CO2, carbon monoxide and sulfur dioxide during poor quality air. And also Zhu in his review actually looked at progesterone and showed that progesterone was impacted. He was able to measure progesterone levels. And so he was able to determine that these associations were significant even with in patients that had the miscarriage, and progesterone may be one of the issues at play here. Obviously, this is associations and so forth, so none of these are randomized controlled trials. I don't know how you would do that, but certainly the association is certainly something that seems to be present. There's other, literature in terms of, national organizations becoming involved, but basically this climate vulnerabilities have again been associated with patients who are in low income and what they describe as minoritized communities. But the data really is sparse, and especially in folks that are more vulnerable. Disparities were determined to follow 3 common pathways: basically exposure, how bad was the heat emergency, for instance; sensitivity, were these folks housed in areas where they had protection from the environmental effects; and then resilience, what was the underlying health of the individuals in these communities. But certainly all of these would increase because certainly exposure is increased in folks that are, in poor districts because they do have more exposure to poor environmental health. And then the sensitivity and resilience also would be something that would be associated with climate justice. This is something that's seen throughout the world. We have, changes in family desire in Africa due to associated with heat emergencies as folks decide, that this may not be a time to reproduce when there's all this ongoing. In terms of policy, so one of the things we'll talk about shortly is adaptation versus mitigation as an approach to climate action. But some of the models have even gone forward to calculate what the needs will be in the future, depending on which model you're looking at in terms of temperature increase. But one model that was in the proceedings of the National Academy of Sciences said that by 2100, folks especially in poorer communities, would need 142 extra indoor days because of all sorts of climate emergencies. And that African Americans in the Northeast had greater vulnerability. They had leakier homes, which actually protected them less well from the environment, and that adaptation would be difficult for them. The other paper, I'm going to skip. This was a reflective paper that actually didn't contribute much data. There are ways we can try to measure this, and this is one of the few that I've seen. And so this is a group again in Texas, actually tried to create a climate vulnerability index. So for those of you that are residents out there, this actually looks like something that would be valuable to actually maybe incorporate into some research that you might be considering doing. but basically they looked at public health, at social, economic, and environmental and climate data, and created this climate vulnerability index, which can be used to identify particularly vulnerable communities. That combined with, our very granular data, for instance, in California, where we have a lot of access to outcomes data, especially for newborns, I think is really something that might be valuable in terms of our own research. You can create heat maps with this and help to identify folks that are particularly at risk. In their study, they actually did this, and they did it in Texas. As you would expect, there was a significant vulnerability in poorer communities and more vulnerable communities to the heat emergencies that they certainly have been seeing over the past few years. Okay, so that's where we are. A little bleak, but let's see. Okay, where are we going? So where are we going? And so this is something that's pretty complicated because we don't know. There's so many things that can impact where we are going in terms of, and really at the end of the day, the most important variable that we're looking at in terms of impacting the environment are greenhouse gases. As an aside, I will tell you that for the longest time in the climate change movement, there was a hesitancy to attack the petrochemical companies, the oil companies, and so forth, because they were, seen as it would be seen as somehow injurious to the American economy and so forth. So there was a lot of hesitancy to not attack them directly and to kind of take this indirect approach to how we can impact greenhouse gases. I think the gloves are off. I think at this point, because of the rates of things that are going on in the world today, I think we really need to be very clear that it really is about a lot, or mostly, or almost all, about greenhouse gases. So, but those are not the only things. And so this is a model that has been created. It's been around since the 90s, I think it was developed, but basically it's the shared socioeconomic pathways. And what it tries to do is not just to kind of predict how much greenhouse gases are going to be increased, but it's also going to take into account how other societal things impact that. For instance, when Russia invaded Ukraine, it actually affected this model in an adverse way. There's lots of consequences and some of them very complicated, that can increase the SSP in the short term. So the SSP is, like I said, an attempt to anticipate temperature values based on these varying models of socioeconomic change. Certainly, we can think of an election coming up that might also have this impact as well. And this is assuming minimal efforts at greenhouse gas changes. In other words, Bill Gates doesn't develop something magical to take all the carbon out of the air. It's just what is going on in the world today, and in a very pragmatic way. And so you can see that, the ideal would be to keep it below 1.5, which is net zero, basically. But most of the models really don't, at this point, suggest that we're going to be anywhere near net zero, with most of these models as they currently exist. So, things like nationalism also can have a significant impact. Things like you can probably understand where the models might be affected by a lot of things that are going on in the world today. All right. So that's where we are. That's where we are going, although where we're going really is still kind of uncertain, right? So what can we do? So I really want to make this a little bit, and the reason that I said that we're going to be a little bit, that there's going to be some positive, is because I really want to make this kind of an action-oriented kind of approach to things. I think for the longest time, those of us who have been working in this area, me a limited amount of time, but most of the ones that have been working for longer have been basically being descriptive of what is going on, and the action is something that has not yet really been kind of consolidated as a way we can, there's certainly lots of activity. There's a lot of people working on reducing greenhouse gases and so forth, and but at this point, in terms of what we're doing, it's really not been a consolidated effort. So where do we go? All right, so I'm addressing a provider audience here. And one of the things that I want to really highlight is that healthcare providers in the world are the most respected, or trustworthy individuals that exist. For better or worse, that seems to be the case. And when I say physicians here, I think I'm also talking about nurses, I'm talking about advanced practice providers, I'm talking about folks in healthcare who have direct patient responsibilities. So they're among the most trustworthy individuals in the world. If you look at politicians generally, they're the least trustworthy folks in the world. But guess who's been more active and has a bigger voice in this whole debate up to this point? It hasn't been the physicians. So there's a lot of data to suggest that physicians have not stepped up to lead and make their voices heard. Lots of data. In general, physicians tend to be supportive that climate change impacts human health. This is something that as scientists, we feel, or science-oriented individuals, we feel that that's something that is pretty well proven. So there's no debate here. But then there's a real gap between that and feeling that they know enough to lead in this effort. And then there's also even a reticence to discuss climate change with our patients, with our colleagues, with other folks, because there's fear that there's a backlash. What are you doing talking about climate change? Your job is a doctor, and your job is to be a reproductive endocrinologist and make the best embryos and get me pregnant. And that's, stop talking about climate change. It's not what you do. Well, in fact, so there is a real concern about that. I will tell you that I actually, and as we'll see later, I've presented this to the Society for Reproductive Endocrinology and Infertility. I was a previous president. I'm pretty well, I know everybody in that community. And when I said, okay, I'd like to join this group and make SREI a representative, and I'll show you what that means in a second, folks were like, what does that mean? And what does climate change have to do with us? So there is a real resistance because of perceived relevance in this. And then because of that, or maybe associated with that, or maybe because communication is relatively poor, patients are not making the connection between climate and health. If you push them, they may think, well, pulmonary, maybe maybe my asthma gets worse when things are bad in terms of poor wildfires or wildfire air and that kind of stuff. So, but in general, they don't make the general connection that can affect their mental health. It can affect their infectious vulnerabilities. It can affect their chronic diseases. So that's something that we need to kind of work on. So again, just in terms of general concepts, there's 3 climate actions that can be taken at this point. The first is mitigation. Mitigation is reducing greenhouse gases in order to prevent secondary effects. COP21, which is, I think, the Paris COP, the goal was to keep temperature rise. And when people talk about the Paris Accords and all this is what I think they're talking about, was to keep temperature rise at or below 1.5 degrees Celsius over pre-industrial levels. The idea here is that would minimize the effects of climate and greenhouse gases on our health. Adaptation basically assumes that there might be some level of increased greenhouse gases and environmental changes, and how can we protect human health by adapting our systems, our healthcare, whatever it might be, to protect. And then resilience. Resilience is a relatively newcomer to this trio, but basically it's the capacity of the individual to withstand change and recover from these insults. So basically, how healthy is your population and how likely are they to resist the impacts of climate change? In terms of, so those are the kind of the basic climate actions, but what are the levels of climate action that we can take? Well, I like to break it down, and other folks are starting to do this as well. We're all kind of, this was based on a paper that came out a couple of years ago from a social worker of all folks in the Midwest, that there are 3 levels, and one of them is micro, and that's really basically one-to-one action. So for instance, as physicians, making sure a patient has adequate cooling for heat emergencies. So adaptation, and it's not just air conditioning. There are other strategies, and this is where you kind of have to do a little research, but there are other strategies beyond just air conditioning to improve cooling. Optimizing patient health to withstand emergencies. So this is resilience. So this is taking care of your patients so that they can withstand some of the increased insults that are coming. And then warn patients, we know possibly when these wildfires are happening, and reduce exposure in the home, and that's just adaptation. Meso is kind of in between, and this is local action, so more than one person, but not at the macro stage yet. And this is local action, making sure your hospital reduces greenhouse gases. By the way, most people probably don't know that healthcare is responsible for over 8% of greenhouse gases. So we are probably cranking out a fair amount of greenhouse gases right now here. This would be mitigation, optimized climate efficient hospitals. So this is both adaptation and mitigation, and reducing OR waste. This is something that we have started to do. And, this is something that's going on in our hospital even now. And so this is presumably mitigation, I would think. Community tree planting is something that we do as communities. And this was mitigation because if you put up trees actually give you shade, and shade reduces your local and microenvironmental temperatures. And then adaptation as well, because trees also, well, actually, that was the tree plant. The trees also absorb carbon dioxide, and so that also is a way of mitigation. So the shade is actually the adaptation piece. Or you can, as a doctor, you can go on TV and warn pregnant patients about, that wildfire and how they can cope or adapt or prevent any kinds of secondary outcomes in their pregnancy. So those are things that are happening, but they're probably not happening to the extent that we probably should be doing. And then macro is super important, and this is because it's so this is state, national, international level stuff. This is policy, this is legal action, this is voter drives. Where we fit in is we're subject matter experts for the EPA, for HHS, for the White House Council on Environmental Quality, for White House Justice 40. Now, Justice 40 is an interesting thing in the theme of environmental justice, because it's a mandate from Joe Biden from last year, from President Biden, that mandated that 40% of all resources federally directed would go to those who are underserved or particularly vulnerable. So it's an attempt at climate justice from the White House, but it is a presidential mandate. So climate action, so they're all important, but meso and micro will eventually be swamped if greenhouse gases are not substantially reduced. All right, so what can you do? So this is something that I think there's so much available that sometimes, and that's part of the problem, there's so much available that then it becomes hard to do anything. So one of the most important things I think we can do is medical society. So one of the ones that I'm really particularly fond of is the Medical Society Consortium on Climate and Health. It's 25 state action groups and 53 medical societies, including SREI, SGO, and ACOG, as you can see here. All three are there participating. SREI, I actually, this is when I proposed it to the SREI board. They said, okay, but go for it. But it, so it is something where we're represented on a very large scale. We've been to the White House, we've been to the Capitol to advocate for for climate and the impact on human health. 700,000 physicians are represented by these 53 medical societies. It's ever growing. And it is something that the Medical Society Consortium in particular is every day sending me things to tell me, things that I need to do or things that I can help to do. Sign on to these things. I get SREI to sign on to amicus briefs and things like that to try to support activity that's going really at the macro level nationally to help combat climate change. ACOG is also very involved. They've actually been pretty involved in educational activities. And the AMA is really powerful, but it's really cautious. They're a good ally, but they are very careful about what they support because of the political diversity that is under their tent. And so, but they're very forceful because they really do have a seat at the table nationally. NGOs, Climate Action Campaign is something that is a coalition of a lot of different groups They do a lot of education, a lot of work in the community. Physicians for Social Responsibility, you may know of them as an anti-nuclear proliferation. In fact, they got the Nobel Peace Prize back in the 80s, I think, for their work with combating nuclear proliferation. But they now actually have come on board with climate change, seeing climate change as an equivalent world risk, as you know, even as compared to nuclear proliferation. And then the American Lung Association, really important. When we go to Capitol Hill, they're the ones that have the lobbying folks that train us and tell us, you know, who we're talking to and what we should say and those kinds of things. They've been at it for a long time, and they are a very powerful organization for, as you might imagine, the Lung Association. Other resources, I think Andrea Henkel talked a little bit about Vote ER a couple of months ago at our faculty meeting. And basically, it tries to promote civic engagement in terms of not just voter registration. That is something that they do very powerfully, but they also have a lot of other things and not just in climate change. This is something in civic engagement for the healthcare system writ large. The Environmental Voter Project, and this is to close a really substantial gap. So it turns out that those the folks who are environmentally inclined registered voters are really bad at voting. And so this is to close that gap. And so one of the things that I've done personally, a couple of my colleagues have done, is to actually make phone calls, calling these environmentally inclined registers folks throughout the country and tell them to please vote, and they actually have good data, really good data that I've seen that actually supports that they're being effective. Echo America is 100 organizations, and they focus really a lot on training local leadership. So they're present in Montana, they're present in Wisconsin, leading local organizations on environmental activities. The EPA is, as a government agency, is really valuable, really important. It's recently probably been hobbled, if you're familiar with the Chevron decision by the Supreme Court, which increased the amount of judicial oversight on the decisions that were made by the EPA. This is going to have a real impact in a negative way, regardless of who wins in November. Part of the problem is that they ruled that, so what happens is when Congress makes a law, let's say an environmental law, it's the agencies that actually make the specifics or write the specifics. But now they've made that specific writing of metrics and specs and so forth. It's made it subject to basically legal action, so you can be sued. So the EPA can be sued if it's, for instance, increases the PM or decreases PM 2.5 levels for power plants in the Midwest. Then now that's more subject to judicial oversight, which is really going to be problematic. Climb here at Stanford. So this is, we're on to MESA resources, and I think I've got a few more minutes. But MESA resources, CLIMB, which is Climate and Medical Education, the new group that Stanford is just created. Barb Ernie, who you guys, if you were here about 5 years ago, she gave grand rounds on this very subject. And it's meant to try to improve education among the medical community here at Stanford. Excuse me. And one of the problems has been is that, you would think that medical schools would be a really good place to for learning about climate change. Well, in fact, it's been a hard sell at most medical schools just because the educational curricular landscape is just so tight. There's just no room to put anything else. But it's super important. They're often sympathetic, but then the curriculum is, like I said, is super slammed. We're actually working. I'm actually been working with Klein on a new thing called CHILL, which is, I'm terrible at acronyms, by the way. Even though I was in the Army for 27 years, I didn't learn how to do acronyms really at all. But this is the best I can come up with so far, which is basically climate health for instructors and learners. And basically, it's modeled on a LEAD program, which is Leadership Education Advancing Diversity. The same idea to create leaders, local leaders in each of the departments, in each of the areas, the divisions and so forth, to create a cadre of individuals that are trained and comfortable in their advocacy for climate health. I-Sustain, which is something that Barb Burney, who's the head of Climb, is worked on. And basically, it's a toolkit to reduce OR waste. By the way, it can be modified for other specialties, and it's something that we certainly can do. Energy Star for Hospital, which is something that's supposed to be done. I'm not sure that Stanford has yet participated. It is just basically it's a metric to make sure that hospitals are mitigating as much as possible in reducing greenhouse gases. Micro resources, these are really important because these are where you can give to your patients. There's one that's Climate Health Tips for Pregnancy. It's produced by the CDC. So if you have a wildfire event, you can kind of pull this up and know what to tell your patients. Climate RX for patients. This is a QR badge. I wear the QR badge, and if the topic comes up, I just have the patient kind of check on my QR badge, and then they can actually use the information from the Climate RX to help guide their patients or themselves in terms of climate responses. Toolkits for parents. I mean, as parents, we are all concerned about our kids, and there's toolkits for parents during climate emergencies to reduce the impact on our kiddos. And then posters for clinics and waiting rooms, things that we can post in our waiting rooms to make people aware and to make that connection for patients in terms of climate and their health. There's also data available to help you put together talks and maybe even create research. Climate Central is an independent group. It's scientists and communicators, and it's used by journalists a lot. It's used by policymakers an awful lot, and it just has a lot of very currently created new data on climate health. And Sciline is actually the AAS, which is the American Academy of Scientists, right? American Academy of Science, right? So it's basically also a free service for journalists and scientists. Great graphics, beautiful pictures, and good data. So if you're putting a presentation together on climate change, this is a good resource for you. So I think that's really it. I'm sorry that I've kind of gone a little fast, but really at the end of the day, it's a lot about the polar bears, but it's also a lot about us, and we need to be there. This is from the Medical Society Consortium visit to Capitol Hill a couple of years ago, and this is about 2/3 of the California delegation. We need a lot more people there. So it'd be wonderful if we have more people join the effort. And then really one of the things I'd like to share with you, which this is something that's actually very important to me, it's not just about, we can all get kind of really wrapped up in our work and our advocacy and get exhausted. But I think this is something. Edward Abbey was this writer. He was a naturalist, and actually not without controversy, but basically wrote this wonderful little piece about being an advocate. And I'll read it. It's one final paragraph of advice. Do not burn yourselves out. Be as I am, a reluctant enthusiast, a part-time crusader, a half-hearted fanatic. Save the other half for yourselves and your lives for pleasure and adventure. It's not enough to fight for the land. It's even more important to enjoy it while you can, while it's still here. So get out there and hunt and fish and mess around with your friends and ramble out yonder and explore the forest, climb the mountains, bag the peaks, run the rivers, breathe deep of that yet sweet and lucid air. Sit quietly for a while and contemplate the precious stillness, the loveliness, the mysterious and awesome space. Enjoy yourselves. Keep your brain in your head and your head firmly attached to the body active and alive. And I promise you this much. I promise you this one sweet victory over our enemies, over those desk-bound men and women with their hearts in the safe deposit box and their eyes hypnotized by desk calculators. I promise you this, you will outlive the bastards. All right, so thank you very much, and I appreciate your attention, and I guess we have like 2 minutes for any questions you might have.
That was fantastic, and it's such a thought-provoking. There are comments in the chat. Loved your slides. So one of the things that I think the Kim was asking is where you got that amazing quote from.
What's that?
Where did you got that amazing quote from? I think Dr. Adams was asking.
The coat?
Yeah. What is your quote?
No, Ruben, I missed who did that quote. That quote was amazing.
Oh, I'm sorry. That quote, yeah, that was a fellow by the name of Edward Abbey, who's a naturalist. I think he died in the 90s. But he was a naturalist. He was one of the early environmentalists back in the day. And so it's really one of my favorite quotes, because it really kind of puts some perspective. We are doing this, but we're also doing it for a reason, for ourselves, for our kids, for for the future. So I think that that was a really nice quote. So yeah, thanks.
Yeah, fantastic.
I know it's very thought-provoking, and I'm feeling better knowing that this is one of your interests for the next level. I was reading this book from a Stanford author actually called Strength to Strength, and how we transition from our careers in different stages. And I think your strength to strength now is going to be this climate fighting. So I'm very excited about it.
Well, thank you very much. I really appreciate it. Yeah, no, I hope so. And one of the things that I'm kind of hoping to do, and this is, I guess we'll close out because I think there's not other questions, is one of the things that I've talked to Kate Shaw about is possibly doing some sort of climate elective within the residency, or with, maybe within women's health, where it might be available to not just OBGYN residents, but to other folks interested in women's health and climate. So something more to talk about beyond just the, so something more to talk about in the future at some point.
Yeah, I think it goes into the lines of Michelle was just put in the chat. That would be good to know how to sort of train and approach this in our older societies. Definitely SMFM is looking into this, and there is some enthusiasm, but it's totally new, and also you want to be very systematic and thoughtful to really create it.
Yeah, definitely.
Yeah, but I would say myself and the entire department, we're so lucky to have you and to have such a pioneer forward thinking. So tons of thank you, tons of congratulations and excitement. Thank you for bringing this to our attention. And I think I'm gonna say goodbye to everybody and conclude our amazing diversity week. Another successful celebration. It's been wonderful to see people showing up for different talks that we've been holding, and also for our wonderful keynote speaker. Looking forward for next year. It's an all-inclusive. So if anybody has topics or has attended to a great meeting or had listened or reading or seen or YouTube, TikTok, whatever, and you want to see it next year in our diversity week, just email us, contact us. It's all inclusive, but wonderful and excited to see how we're moving forward. Thank you, everybody.
Thank you.
Thank you. Thank you.